Walmart news. Walmart announced that they are going to be cutting healthcare benefits for 30,000 part-time employees when they work less than 30 hours per week. Walmart Senior VP for Global Benefits, Sally Wellborn, said, "We don't make these decisions lightly. Like every company, Walmart continues to face rising healthcare costs. We had to make some tough decisions." At the same time, Walmart announced that they are going to be getting into the health insurance business. Interesting. Not that these are necessarily connected, but some of those part-time employees who lost their health insurance from Walmart, they will now have the opportunity to buy health insurance from Walmart as retail customers. How convenient, Lewis.
I'm sure it'll be very cheap with great coverage too.
The world's largest retailer plans to work with directhealth.com, which is an online health insurance comparison website, to allow shoppers to compare coverage options and enroll in Medicare plans or the public exchange plans that were created under the Affordable Care Act. The program will target Walmart shoppers who are confused by the healthcare enrollment process. Yeah, they're targeting the vulnerable and the confused, which seems to be often those that are targeted by Walmart. Like their employees, for example, and this is really funny. They say they include those whose employers scaled back their coverage to those who don't have any insurance. So Walmart is essentially getting into the health insurance business. But not only are they getting into the business, they're getting into it specifically to cater to the types of folks that have just had their insurance maybe taken away by their employer, like these 30,000 part-time workers at Walmart. What a perfect fit, Lewis.
Perfect. This is a company, of course, that is still recording billion-dollar profits every year. I guess it's just not enough. It's never enough. You can't treat your employees well, and now you're just screwing them even more.
Well, here's what's going on. Walmart is also testing 11 primary, they're called healthcare clinics, okay? And they're run by Walmart, essentially. And I think it's very clear what's happening here. Walmart is looking into, we can start offering health insurance, we can test some clinics. Walmart, the Walmart health insurance for-profit industry, that is a very scary thought. As if it's not bad enough that our healthcare situation in the U.S. is for-profit, imagine if Walmart becomes one of the leading providers of healthcare.
You know they're going to try and set it up in a way so that just about every employee they have is coerced into buying their healthcare.
We need to be moving health insurance and healthcare away from the profit sector, not to one of the most profit-hungry companies in the world. This is the worst possible direction that healthcare could be going in, and we need to be aware of it. We need to fight this. It's just so depressing. Next, I will talk to Gad Saad. We are going to talk about the Sam Harris, Bill Maher, Ben Affleck controversy. So many people asking that we talk about this, and we will next.
Today's question: how do deductibles, co-pays, co-insurance, and maximums work? The simple answer is they define the different ways health insurance companies pay most of the costs to keep you healthy. It's a little complicated at first, but not when you understand how everything works together. Your deductible is the amount of your medical costs that you have to pay before your health insurance begins to pay. These amounts can vary dramatically between different plans. Here's an example. Gina has a health plan with a $1,500 deductible. If Gina only has a few little things go wrong during the year that cost less than $1,500 total, she's going to pay the full amount to treat them. However, if Gina has a catastrophic injury or serious illness that requires a lot of medical care to get better, she'll pay her $1,500 deductible, and then her health insurance takes over to pay most, if not all, of her additional covered costs. Often, plans with higher deductibles have lower monthly premiums. The exception to deductibles is preventive care, like annual physical exams and routine gynecological visits with in-network doctors, which are covered by most plans even before meeting a deductible. Sometimes, even after you've met your deductible, you may still have to pay a copay. A copay is a set price that you pay when you visit the doctor, a small portion of the total bill. Copays vary by policy and can change if you see a specialist instead of a regular doctor or seek treatment out of your provider network. Prescription drug coverage may also have copays, which can be higher for specialty medicines and lower for generic drugs. Let's say Gina goes to the doctor with a case of mono. Her doctor charges a $30 copay, and when Gina fills her prescription, she pays a $5 copay to the pharmacy. Her out-of-pocket costs are $35, and her insurance company will reimburse the pharmacy and the doctor for the difference between the copay and the cost of treatment. Some plans have coinsurance, which is the way you and your health insurer share the costs of your care after you've met your deductible. For example, if Gina is injured and she's met her deductible for the year, her health plan will pay 80% of the cost of the rest of her covered expenses, leaving Gina responsible for the remaining 20%. Maximum out-of-pocket is the most you could be responsible for paying for during the plan year for covered expenses. So to sum it up, deductibles are the portion you must pay first before your insurance pays its share. Then you pay only a small portion of your healthcare costs, either a set copay amount or a coinsurance percentage. Maximum out-of-pocket is the most you will pay for covered treatment in 1 year. So now you know. Until next time, stay smart and stay healthy.